science can say about the relationship we have with ourselves and how we can help the people that we work with in their relationship with their selves. Really, this relationship or the view that we have about ourselves impacts every choice that we will make in our lives. So where there are limits or where there's parts of ourselves that we don't want to look at or see or acknowledge, these elements of what we're trying to push away or deny or ignore will impact the type of partner we choose to have, the type of jobs we choose to be in, etc., etc. So really, we can't get away from, as practitioners, as behavior change agents, or even in everyday interactions with people, people's relationship with themselves is something that is something we can't ignore, and something that we really, as practitioners, need to help every single person we work with. To start this and thinking about this, I want to give an example of Sarah, and this is somebody who is struggling in the way that they're relating with themselves, and somebody who is representative of somebody who may come into the therapy space, hoping to be supported in terms of their relationship with themselves. So Sarah would say, I'm a waste of space. I'm not even worth my own time and effort. I don't do anything that matters. And when I do try to do things, I mess them up anyway. I don't actually matter to anyone in my life. I'm just a burden who causes others to suffer. I cannot stand myself. The world would be a much better place if I was not in it. Hopefully, in this session today, what we're going to look at is how can our understanding of cognition from a relational frame theory point of view help us to help somebody like Sarah in her relationship with herself. Broadly, the space that this takes us to is trying to move from all the different varieties of ways in which we ask the question, am I good enough? All the comparisons that we make between ourselves and others, ourselves and past selves, our past self, ourselves and idealized selves that never existed. We want to look at how we can really get fixated on that am I enough in comparison question, and actually move out to seeing that the real question that can be helpful for us to ask is, in this moment, am I showing up on purpose in line with what matters to me? Rather than getting caught in these relations of whether I'm enough, that just will never end. There'll always be someone smarter, prettier, funnier. There's always an ideal self that's better. But really what matters is, can we pivot people that we're working with to be able to show up and in any given moment on purpose, to be able to live the lives that they want to, not trapped by these sort of comparisons that limit them. So when we react to things, that will feed how we describe ourselves, because that's some of our behavior, our reaction. And of course, this reaction is a lot to do with our learning history. And the thinking, our thinking is a big part of our learning history. So we want to understand cognition, to be able to understand fully our relationship with ourselves, and to inform how we might support people in having healthy relationships with themselves that will work for them. So from this contextual behavioral science point of view, then relational frame theory provides an account of cognition and language thinking that can inform our understanding of self and how to broaden our experience of self. Just briefly, to think about what RFT is saying, or what is at the heart of this theory of cognition. From the RFT perspective, relating is this responding to things in terms of each other is critical. It's a critical skill that we develop that allows us to engage in complex cognition, such as having a sophisticated sense of self. So imagine that we can relate things like this. We can relate an actual rainbow to the spoken word rainbow in the English language. When we do that, when someone talks about rainbow, even if a rainbow isn't present, everything that I've learned about rainbows, my experience of rainbows up to that point, comes to bear when I hear the spoken word rainbow. I can relate to an actual rainbow in terms of the spoken word rainbow, even though there's nothing physically in common with those two things, the actual thing and the spoken word. And we can relate things in many different ways. So imagine here we have 4 different things, 4 different stimuli. We have a rainbow, a cup, a skipping rope, a little puppy. And if I asked you to reflect, you could pick out 2 of these and think about how they're the same as each other. You could say, oh, rainbows and puppies are both cute. They're both the same of each other in that way. We could say, how is a skipping rope and a cup different to each other? Oh, you can drink out of one and not the other. How are they the opposite of each other? The cause of each other. We can come up with ways to relate any of these stimuli and everything in terms of each other. This is a really phenomenal skill that we have. But it's important to note that when you think about those different stimuli, those relations are totally arbitrary, the way that we can come up with different ways to relate them to each other. They're not based on actual physical properties of the stimuli in a set way. Just to establish that point a bit more, many species can relate things based on their physical form. So I can train a number of species to be able to pick the bigger than or smaller than sample to a comparison based on its actually being physically bigger or smaller. But what's interesting that us humans can do is we can relate things not based on their actual physical form, but based on context. So imagine you could see this comparison in samples and think, oh, which one is bigger or which one is smaller? And you might think, I don't really know. But if I give you some context and said that red is greater than yellow and red is less than purple, with these pieces of context or these contextual cues, you can now readily respond to yellow as greater than red, as purple as less than red, even though that's arbitrary, right? They're not actually greater or less than. This type of ability to compare things gets even more tricky, gets particularly tricky when the things that we're arbitrarily comparing are things to do with ourselves. So what if the context is the social context and it decides that you're good if you're wearing green, but you're not wearing green? In that context, it's arbitrary that this has been set up as important, but you could feel bad in comparison to others that have this thing. And fads and fashions and trends do that all the time, create arbitrary things that are fashionable or good to be. And we can feel bad when we don't match up in comparison to them. So this relating that we can do in arbitrary ways, we can do it in many different ways, as we saw, not just same as each other. And here we have some examples of symbolic relations that are, same as. thinking about the self. I'm a failure. I'm the same as a failure. Opposition. Everyone else is a success. I'm the opposite of success. Distinction. I'm just different to others. Comparison. They're all much better than I am. We can rate hierarchically, which is like categorizing or class inclusion, as Piaget might talk about. I am part of a group who have something wrong with them. We can relate based on time or temporality. At one point in time, I used to think I could manage. Now I don't. Or like Sarah, thinking about that past self that somehow she wants to be again and doesn't feel like now. And we can relate based on perspective. If I were you and you were me, you'd understand. And we're going to see more about this relating based on perspective as I continue on. So what's important here is we can make sense of anything arbitrarily. And that gets really tricky when we're able to construct a story about ourselves in terms of what we're limited by, how we compare to others, whether we're good enough. And so we want to really support people to be able to see, where is the story about myself helpful and useful for me? And where is it not helpful and not useful? As a functional contextualist, what's true for us is always what is useful and helpful to give access to the people that we work with a vital life. So for every individual, they can check in with and track their experience as to, is this rule about the way the world is? Is this reason for why I'm this way? Is this helping me broaden out my life? Or is this making my life smaller? Is this allowing me to show up in purpose? That's great. Or is actually this blocking me? Sometimes I use this example from Sesame Street to show just the arbitrary nature of the way these sort of rules and reasons can get set up. But once they can be really real in terms of the consequences of our behavior as we follow them. So, Ernie, why is that banana still in your ear? Listen, Bert, I see this, I use this banana to keep the alligators away. Alligators, Ernie, there are no alligators in Sesame Street. Right, it's doing a good job, isn't it, Bert? So we think about this arbitrary relating that we can do. And then when we think about the construction of our sense of self and how that might be fed by this, we want to think about this fundamental distinction that there is between our actual behavior and then us reporting about our behavior. So, I just clapped. That was a good clap. That was the best clap I've ever done. That was better than any other clap. I think what I am is I'm a good clapper. Okay. What I was doing there, first of all, there's the actual behavior, the clap. And it's me saying I did the behavior, and that's different to the actual behavior. A parrot can probably do that. I just clapped. And then there's reporting verbally about the clap. It was a good one, a bad one. And that's this relating. There I can compare it to previous claps. It's coming up favorably. It's a good clap. And then I can construct a concept of who I am in light of the way I've reported that behavior and responded to it verbally, compared it to others, my past clapping. So then to solidify that, Skinner sort of initially made this distinction that there's a difference between behaving and reporting that one is behaving, or reporting the causes of one's behavior. And then Steve Hayes sort of went further with that definition, that it's not simply behaving with regard to one's behavior, but behaving verbally with regard to one's behavior. And verbally, from the relational frame theory point of view, is this relating things in terms of each other. So as I start to compare my current clap to past claps, I'm behaving verbally with regard to my behavior. And then the concept of self starts to emerge as I respond verbally, compare it, and think, I'm a good clapper. That's who I am. When we think about little children as they begin to relate more and more of their own behavior, not just things in the world, like this word means cup, this word means rainbow, but as they start to relate more and more of their own behavior, I feel happy. And compare it to that of others. I'm happier than you. Then they begin to have a concept of self. And of course, this concept is not always based on things that are helpful or useful in terms of the way the concept develops. So through this process, relating things in terms of each other, relating our behavior in that way, the self becomes a concept. So the experiences are the experiences that we perceive, become quickly evaluated and categorized. And we start deriving networks around those. I'm a good clapper, me, because it was better than my last clap, etc. And we don't get reinforced for noticing that I'm relating things based on context. We get reinforced for talking at the concept level. I'm a good clapper. How are you? And of course, it wouldn't be workable in our normal dialogues with people not to obviously talk at the concept level. But we also want to be able to come back from that concept level and broaden our sense of self to be able to see that I'm relating things about myself. I'm comparing, making comparisons to myself arbitrarily that are either useful and helpful or not. Some of them will be really helpful. Some of them won't be helpful. So I want the flexibility to notice which is which. So from the relational frame theory point of view, then, pragmatically, even from the onset of the first relational frame theory book, the Purple Book, 3 different pragmatic senses of self were talked about. This is not trying to construct different selves, but really to think about there are different senses of self that when we think about them in this way might help inform the type of work we want to do to support people developing a healthy concept of self or healthy experience of self. So the first of these is self as the content. And this is where we're seeing ourselves as the actual concept or the content of the things we're saying. I'm a good clapper. That's who I am. Then there's the self as the ongoing process. We look at each of these. And that is where I see myself. That is the self that exists in any given moment, that ongoing awareness, that in this moment here and now, I'm having a thought and a feeling and some sensations. And they're different now and now and now. At any given moment, I'm having a current experience. It's not necessarily my story about myself, it's just my current feelings, thoughts. And then there's a broader experience of self that we want to be able to develop with the people we work with, developing this flexible sense of self. And that is called the self as the context, or we might think of it as the witness of all our experiences. So I can kind of take that step back and be able to witness the different ways that I'm relating things in the world. I'm able to notice my thoughts, but notice that a part of me notices these thoughts. I don't have to be any of these specific thoughts. So when we think about self as the content, we can kind of want to illustrate how operating from that space, that actually the very things that we're trying to avoid can actually end up being self-perpetuating when we're caught in that story about ourselves. Like as if it's a truth rather than looking at the thoughts and stories that we have about ourselves in terms of whether they're helpful or not. So imagine somebody who evaluates themselves as stupid. They've made a mistake and they see themselves as stupid. They see themselves as pathetic and they see themselves as awkward. From their learning history, It is their belief that people who are stupid make further mistakes. They're not, that nobody loves people that are pathetic, and that awkward people are worthless. Well, then it would be, from their learning history, it can logically make sense and be coherent for them to come to the conclusion that because of this, that they are unworthy of the affection or trust of other people. And they may come to the conclusion that then, therefore, they must avoid intimacy. This will result in a lack of contact with social contingencies, which will result in feelings of loneliness, which can result in them seeing themselves as a lonely, sad individual, which of course is going to take them away from getting social contingencies, having intimacy, having affection of others, learning that they are worthy of that affection of others. So we want to look at where is it that the concepts that I have learned about, the ways that I've learned to relate myself in the world, where are they useful for me and where are they blocking me? When we think about the self as an ongoing process, this sort of second pragmatic sense of self, from a relational frame theory point of view, really where we're trying to move in here is looking at the critical ability to be able to discriminate between my experiences. I need to be able to understand and label what my experiences are internally that are the same as the labels that the rest of the group that I'm in call them. I need to know when my internal experience is anger or annoyance, or my internal experience is happiness or excitement. This experience of being able to identify and tune into myself at any given moment does feed my self-content, because, oh, I liked it when I ate that ice cream. That tastes good. Ah, I'm someone who likes ice cream. And also it's necessary for me to be able to access and discriminate my current experience at any given moment for me to be able to then broaden, as we'll see, that experience of self to the witness and the self as context. From the RFT point of view, as we said, relations of sameness or coordination and distinction are critical for us to be able to label and discriminate our feelings, sensations, and thoughts. It's actually very hard to get our wants and needs met if we're not able to discriminate our experience to know what it is that we do want at any given time. We'll often be working with people who may not be very good at tuning into their current experience. And this can come from a number of different sort of histories can lead to that. So when we're working with people, we might see that it's hard for them to be able to tune in and acknowledge what they want rather than what other people want, or to be able to tune into what their experience is at any given moment. So one of the reasons why this can emerge is if there's been a dominance of a thing that's called, in the relational frame theory literature, pliance, that's coming from the origin of compliance, where individuals have learned growing up that they should follow rules and do what the rule says to get the social approval of somebody who's giving the rule, broadly. So, you know, I take the umbrella with me when it's raining because mom said you should take the umbrella and she'll be happy if I take the umbrella, rather than following rules because from my experience they work. So I got wet the last time I didn't take an umbrella, I should take the umbrella. So if there's sort of a dominance of pliance, where initially young kids will engage in pliance to learn about new things, like don't touch the hot hob, you might burn your hand. But we want that to start to change over to noticing and tuning into your own experience as the guide as quickly as possible. When that doesn't, then that can present in adulthood where the individual finds it hard to actually be able to discriminate what they need and want, discriminate their internal experience. Another context in which this can emerge is where there's not much emotional talk or talk about emotions in the home. So there isn't much chance for that literacy to be developed around being able to say the difference between happy, excited, ecstatic, angry, annoyed, frustrated. Can also happen from avoidance that emerges later in life. So if an individual has a situation, imagine they had, you know, a big rejection from a traumatic or a breakup, a breakup, and they think, I'm not going to feel that vulnerable again. I am not going to look at or let myself be impacted in that way again. So they just sort of won't, they kind of square off that side, that piece, and they don't want to look at that element of themselves or let themselves have that experience. When we try to faction off or push away certain experiences, that makes it hard for us to be able to see our full experience, the good, the bad, and the ugly. And that will start to impact other areas where I'll get defensive about certain things, or I'll avoid going into situations where that might happen, or I'll limit the options, or I play it safe. So that will start to be another area where we start to see that people are not or don't have the skill to be able to tune in to their current experience. And of course, then there can be deliberate distortion by a caregiver. Here we might see, you know, imagine if a little boy runs into the room and he's like, I just saw a fox and I was really frightened. And if their dad says, no, you weren't, that would be deliberately distorting, that they're accurately labeling the feeling, you know, tuning into their self-as process. But they're being told that it's inaccurate, or that weakness is something that anxiety would be something that's wrong or bad to be had. Okay. So it's really that sense of self that is tuning into the present moment is something that's really critical. And from the relational frame theory point of view, supporting people to be able to make those discriminations and have that sense of literacy across their current experiences. And of course, the diffusion work that gets done in being able to notice thoughts, and also the willingness work that's done in terms of being able to allow our feelings is really powerfully important for us to be able to tune in at any given time to what our experience is. This is critical for us to be able to fully tune into what we want and need and what's possible for us. Okay. And then as we move into self as context, we sort of want to move from focusing on the world outside of ourselves in that sense of being in that comparison space. Am I good enough? Am I smart enough? Am I better? Am I special? Whatever. Or trying to meet the expectations, wants, and opinions of others. You know, like, what does my friend think about my new car? My mother approve of my choice of partner? Did I offend my colleague by saying that? And then we want to start to broaden our own experience of our experience rather than letting other people's approval be our guide. And this is where, from the RFT point of view, we want to start to be able to look at broadening the experience of self, or that kind of self as the context of our experiences. And if we look at describing this, here's sort of a definition from Hayes in 2011. So self as context involves this sort of coming together and this sort of flexible extension of being able to take perspective, or those perspective relations, I here now. We're flexibly extending them in the sense that we're using them not just to be able to take perspective of another, ooh, you have different wants and wishes than me, but to be able to notice, I here now notice that I'm having thoughts, feelings, and wishes. I here now notice that me a week ago had thoughts, feelings, and wishes, and that this noticer has been there in both of those situations. In fact, this notices her that this I here now is always what's constant across all experiences that Louise McHugh will have. And this point of view, this broader experience of self as a witness, facilitates a lot of experiences, noticing thoughts, acceptance or willingness to experience feelings, compassion, empathy, and that experience of a transcendent sense of self. So when we can access this experience of self as context, that also will facilitate all of these other important skills for our relationship with ourselves, compassion, and our relationship with others, right, compassion and empathy. In terms of relating, as we kind of started with at the beginning, looking at relational frame theory, if we think about it this way, coordination or relations of sameness, when we're thinking about self as the concept of self or the content, we're in the space as I am the same as my thoughts. I'm silly, I'm caring, I'm bad at maths. I'm the same as my cravings, my sensations, my cravings, tingles, cramps, etc. I'm the same as my feelings, jealousy, anxiety, sadness. I'm in coordination, the same as. From that space, there's quite a lot of power to thoughts, right? Because I'm the same as it. So if I'm having the thought, I'm silly, that's what I am, just like I'm a good clapper. But we want to broaden people's experience of self by using our capacity to be able to relate, like to categorize things. So we can use that ability to hierarchically relate, which is just the capacity to see things as class inclusion. We can include parts of something in an overarching category. We can build that experience of I and think about my thoughts, my sensations, and my feelings. These are all parts of a broader I that is the witness or the context of all of these experiences. When we think about it in this way, when we come back to Sarah that we started with at the beginning, we saw like, I'm a waste of space. I'm not even worth my own time and effort. Well, we can now put in that sort of perspective relations, broadening perspective and hierarchical relation, categorizing it as I'm noticing that I'm having the thought that I'm a waste of space. The thought is part of me, but I'm noticing, this broader I is noticing that. So where is the evidence that supports research on this, this process in the acceptance and commitment therapy model, or this sense of self that's talked about from the relational frame theory literature? There's different types of data that are available, studies that are available that have looked at this. So there's correlational data, qualitative research, and different types of quantitative research. So I'm just going to overview that research for you now to get a sense of what's out there. There is 3 different published measures of the self context that have been developed. So the first of these is the self as context scale by Robert Seidel. So all of these are self-report scales. So we know from the behavioral science perspective that psychometrics and self-report have limitations, but also they're used widely. So, you know, that's important too. So Robert Seidel and colleagues developed the self as context scale. And there is 2 subscales within that. There's the centering sense of self, which is akin to self as process or ongoing process. When I'm upset, I'm able to find a place of calm within myself. And then there's a transcendent sense of self, which is akin to self as context. Despite the many changes in my life, there is a part of who I am that remains unchanged. Then Lin Yu developed the self-experiences questionnaire. And really here, Lin Yu emphasized the difference between relations of distinction in terms of I see myself as distinct from my thoughts, and that hierarchical or categorizing relating sense of self, which is the self as context. These are parts of me. So distinction from internal experiences with items like, I am able to separate myself from my thoughts and feelings. And that hierarchical sense of self as container of experiences. I experience myself as more than my thoughts and feelings. And then the 3-dimensional Reno inventory of self-perspective, Tammy Jeffcoat developed in 2015. And she separated out the 3 different senses of self: transcendent, which is self as context; centered, self as process; and entangled, which is self as content. And entangled here is, you know, I struggle with conflicting thoughts about who I am. Okay. So there's 3 different questionnaires that have been developed in published studies to look at self as context. And here what I've done is I've just put a summary of all of the areas in which the self as context has been related to, both positively and negatively related to in terms of correlational studies using these questionnaires. On the right-hand side, what you'll see is I've put in the citations for the different studies that have used it. And then the variables are here on the left of the screen. So self as context is positively correlated with pain acceptance for chronic pain patients, decentralizing, committed action, spirituality, well-being, mindfulness, psychological flexibility, self as process, and less rigid self as content. Self as context is negatively correlated with pain-related interference, functional impairment at work, depression, stress, experiential avoidance, suicidal thinking, psychological inflexibility, neuroticism, and depression-related interference. Okay. So in terms of correlation of studies, that does suggest that there is certainly interesting evidence to suggest this repertoire of being the container or witness of your experience seems to be related to some very positive things, and also the less of it is linked to very negative things. Qualitatively, there has been studies that have looked at self as context, and it's under the functional self-discrimination measure by Paul Atkins and Robert Stiles. So they have developed self as context codes within the self-discrimination measure, where the experience of self, where it transcends one experience of self and events, where you've kind of got this hierarchical categorization, and or this another category that is just looking at where you're distinct from your experiences. Now, there's many other categories within that as well, and they have a centered sense of self, which is akin to self as process also in it. So just to summarize then, where studies that have used this qualitative measure, Atkins and Stiles used it in organizational settings in Australia, and they found that the frequency of the occurrence of these codes after interviews with people in organizational settings, from this, they saw that the more people talked in terms of self as context, that the higher their level of well-being was. So the frequency of them talking in ways that was coded as instances of this self as context was correlated with higher well-being. Garcia Zambrano looked at adults with disabilities, and they looked at an intervention that involved training diffusion and perspective taking. And they did interviews with these pre and post intervention of diffusion and perspective taking. And they found that 7 of the 10 participants who had the diffusion and perspective taking intervention used self as context codes post intervention at an increased level. Moran and McHugh with adolescents in the Irish context, we looked at we gave an online survey with open-ended questions where the adolescent looked at video clips of the character experiencing a specific emotion, fear, anger, happiness. And what we found was we asked them then to talk about instances when they experienced the emotion that the character had in the clip. And we had a textual response. And then we coded their responses to see if they had occurrences of self as context or centered self codes, self as process versus self as context. Higher occurrence of centered self were related to lower levels of depression. And with female participants only, there was lower levels of anxiety also linked to higher occurrences of talking in terms of that self as process, identifying self as process in their responses. Then we had this interesting thing with Varsha Murthy in 2020, where we had the self as context codes that looked at being distinct from your experience were actually positively correlated with shame and psychological inflexibility when discussing the substance misuse for this group. And as we said, this I am different to my experience versus I am the container of my experience, could have been demonstrating a possible dissociation from their experience while using substances. So it's interesting to sort of be cautious about what are we coding for here in terms of looking at distinct to myself versus a container of my experiences being what self as context may well be better equipped to develop or should be looking at.
a really important point, if you're thinking of doing research on this, is that self as context codes, occur pretty rarely in natural speech. So if we're looking at frequency of them as the measure, that is a tricky thing. And we might want to think about ways that we can actually cue the use of these codes. Something that we've been trying to do in the lab more recently is to give instances where someone will see a clip where somebody is engaging in, a guided meditation or self as context exercise, and then sort of asking afterwards, what is this experience? Have you ever had an experience like that? And then coding in that way as showing, yes, they understand the experience of that versus no, might be another way of getting at this, rather than expecting the occurrences to occur in natural language, less likely to talk that way. And then there's quantitative research, looking at self as context. Now, here we had Lynn Yu working in the United Kingdom. She was working in a pain clinic there, and saw 412 adults with chronic pain who were exposed to about 22 hours of ACT each, approximately. They used the self as context measure that she had developed, the self-experiencing questionnaire, that looked at this distinction between me and my experiences and container of experiences. And they saw that self as context scores improved following ACT, with these improvements maintained at a 9-month follow-up. And also that the changes in the self-experiences questionnaire scores of this kind of container of experiences significantly predicted changes in pain-related interference and functional impairment in work and depression levels. And then also there's other types of quantitative research that is out there. A number of studies have been conducted that have looked at, if we isolate and just do interventions that specifically target just self as context as the whole kind of dismantled piece of the intervention, can we get good outcomes with just this type of maybe lab-based studies, or we see outside the laboratory there as well in one study. So with this, then a brief self as context intervention is put in place, and things that have been looked at are a tolerance of aversive stimuli, a distress performance task, completing a task that involves experience of self-criticism, and that is writing down a critical thought about yourself, saying it out loud in front of the experimenter. And what they consistently see in these studies is that the hierarchical or container experience of self as hierarchy, seems to be better if you use that as the intervention, rather than just saying to people you are different to your thoughts and feelings, in terms of being able to get more favorable outcomes in line with this work. And we see here outside the laboratory, Luciano and colleagues looked at adolescents displaying problem behaviors, and they were given 4 60-minute weekly sessions of a self as context intervention. And this intervention beneficially impacted the adolescents in terms of their problematic behaviors, levels of impulsivity, psychological inflexibility, depressive and anxious thoughts, and levels of mindfulness. So if we think about what we've been looking at then in this session, and we come back to Sarah, who we saw at the beginning of this session, we said she was struggling with her sense of self, and that really where she was getting limited was in comparing herself to others, and having that sense of self as being, I am not enough. The way I am, I'm not enough. I'm not like I used to be. I'm a waste of space. And what we want to do is be able to help her to broaden her experience of self, so that she's able to, rather than think, am I enough, move to, am I showing up on purpose in my life, in the directions I want to go. So if we think about then putting in place self as context interventions that involve broadening that experience of self for Sarah, we'd be hoping that where we'd be able to bring her to is, I here now am noticing that I am distinct from my internal experiences. There's more to me than my thought that I'm a waste of space. There's more to me than my thought that the world would be a much better place if I was not in it. I'm the container of these experiences. And unlike these experiences, unlike these thoughts and feelings, the me that is noticing and having them is continuous and unchanging. I can hold these experiences without allowing them alone to define who I am, and flexibly move towards the things that matter to me. So I think that might be a good time to open up to some questions for the last sort of 10 minutes, if there are any. Yeah. And if there's anything people want to ask, they can put it in the chat, or they can. Yeah, Wendy.
Yeah, so I'm a psychiatrist and I've recently started working with adolescents about a year ago. And we're always talking about whether we should be diagnosing people or not. And I'm thinking about how this fits into the kind of self as content thing. Do you think it's harmful to be giving people labels like depression and so on, autism? What do you feel?
I think it's such an really, really important and interesting topic, and you know, and I think there's actually researchers here who look at Lee Huggard is one of the doctoral students here, not in my lab group, but they were interested in stigma around mental health and really looking at that as that really is an important empirical question. Like, what does it do? When is it useful? When might it not be useful? And I think really having that openness to really being openness to that conversation, you know, and I think for some people it may be that it really is extremely helpful, and you know, also there's resource access that it has that's really important, you know, at times, you know, getting that. I think some of the work that she's seeing at other times that there can be times when that's not helpful, and when it can become part of somebody's story about themselves, that can be limiting. So I mean, I think I'm really open to that as something I think we really need to do more work on, knowing that, because it's such a serious question, right? So I know that's sort of vague in answer, but I think it's, yeah, I think we really need to look at where that works for people and when it doesn't. Yeah. I think it's, you know, it's really topical, and I think the functional contextual piece comes in and in this really importantly, because it is really about what works for the individual to get, you know, access to a more vital life, no matter what that is. And definitely from the therapist stance or even the researcher stance, you know, we don't want to be telling people what works and what doesn't. And, you know, but there could be evidence to suggest that these things, because these are more structural, broader things when you're coming to, you know, diagnoses. Look, I think the diagnostic category, the whole system of that definitely is wanting at the moment. I think everybody would sort of agree that there's elements of that could be more effective. Yeah. And then I think the spaces in which it can really help people maybe understand or feel connected to a group, or, you know, feel that they belong, or you know, so there's different parts that I think I'm very interested to know that the answer to that, I suppose. Yeah.
Yeah, I think I agree with that. It sometimes helps and sometimes doesn't. And it's often about whether the person wants it or not.
Yeah.
Yeah.
And you know, holding anything a little bit lightly enough that we're able to see where it's helpful and where the edges of it not being helpful are, and you know, not to fear that's okay. Like, we get to choose then, you know, I suppose, as well. And lots of interesting questions come up around the census in lots of areas, not just diagnosis. And I think when it's not about diagnosis, because that's something maybe an external label that is there and has, you know, got lots of categories and elements to it. But anything else, where it's anything else that we might be describing ourselves as, we get to choose, right? I mean, where that's wonderful and liberating, fantastic, you know. And where it's not, I want to notice, you know, the ones that might not be is where I think I'm, you know, not enough, or a failure, or yeah.
Okay, thank you.
Yeah. Sometimes they say, like, you know, I think of like, do your best, but be honest with yourself about that, you know, and that as well. It's that discerning piece in the whole mindfulness literature as well, isn't it? Like, it's honing that skill of being discerning about what is helpful for me and what's not. And And there's a lot of self process needed for that as well, to track my own experience in that. And sometimes I say, like, you know, the relationship with ourselves, like we have to be able to look at the good, the bad, and the ugly, and then we can really know how we want to be and what we want to do, and where we're trying to please others, and where it's really about us living this wonderful life. And
yeah. Okay, thank you.
So Corolla said, are there any trainings you would recommend on this topic, or training you provide? Oh, sorry, that wasn't it. I'm really sorry. Do you know what just happened there now? And I that thing where it's actually in red, and I will really apologize to you, Corolla, for that. Because I hate when that happens. Oh, good, she said it from. I hate when that happens in a lecture as well, because sometimes you're not paying attention and you're like, oh God, it was in red. It was in red. It was in red. So, but yeah, I'll well, listen, what I'll do there, Corolla, because I'll be able to email you about that if you email me. I'm going to put my email address into the chat function, and you can email me that question and I can answer that a bit more in detail. Yeah. Yeah. Great. So will I conclude there, or?
Thank you so much, Louise. I think there is another question. It was great to listen to you, and there are some comments on chat that they say that they loved your presentation, and it was. I agree with Charlie that it was a great presentation. Thank you.
Thank you very much.
Thank you. All right. Thank you very much, Louise. So we're gonna jump straight as a continuation of a similar topic. We actually have Dr. Ho-Yuen Loh, who is actually a registered psychologist from Ontario, Canada. He earned his PhD in counseling psychology from the University of Alberta, and completed his pre-doctoral psychology residency at the CBT Association in Toronto. He is also currently, correct me if I'm wrong, Ho-Yuen, you're currently if I'm not mistaken, the head of Asia. It's not chapter, right? It's an Asia group under ACBS.
I was not
Was.
yeah. So I founded the Asian special interest group and the diversity special interest group before. Yeah. Co-founded. Yeah.
And still quite active from there, as far as I'm aware. That you've been giving in terms of activities involved.
Yeah,
with that.
trying to do my best. Yeah.
Yeah. All right. And today he'll be actually talking to us a relational approach to ACT. And without further ado, would you want to have a few speech, or do I play a recording now, or what would you prefer?
Oh, yeah, please play the recording, as I will be here. If there is any interaction, I'm happy to interact with the audience. But since I have a voice issue, so that's why I pre-recorded my speech. Yeah, it's easier for me. Yeah.
Yeah. So if anything, you could put in the questions in the chat, and we could always pause if necessary.
Yes.
All right. So I'm just going to start the recording now.
Hello, everyone. My name is Dr. Ho-Yuen Loh, and I am a registered health counseling and clinical psychologist in the province of Ontario, Canada. I'm doing private practice full-time in the city of Toronto, Canada. Today, it is my honor to present at the ACBS Low and Middle Income Conference. And today, I'd like to talk about the relational approach to acceptance and commitment therapy. And you can see my contact information in this slide. So in this 1 hour presentation, I'd like to share some of the things about the relational approach. So first of all, I'd like to introduce a little bit more about myself. So I'm from China, and I did my PhD in counseling psychology from the University of Alberta in Canada, and is currently practicing in Toronto. So also I am a certified therapist in CBT by the Canadian Association of CBT. And I also served on the board of the ACBS many years ago, and currently the past chair of the counseling psychology section of the Canadian Psychological Association, the president-elect of the Association of Chinese Helping Professionals and Psychologists International from 2022 to 2024. So in today's presentation, we will cover 4 parts. What is relational approach? Why does it matter? And how to integrate that into ACT. And at the very end of the presentation, we will have a little bit of interaction. So first of all, what is relational approach? Basically, the relational approach refers to how therapists and clients interact in the context of a therapeutic relationship. It is also known as the process dimension. Please don't confuse process dimension with process-based treatment. That's the thing that we talk a lot about in ACBS. Those are 2 different things. So relational approach basically refers to how we interact in the relationships. And it also differs from the content of therapist and client interaction, or usually we call that therapeutic techniques or skills. So how do we talk is different from what we talk. That's basically what the relational approach is about. It is also called interpersonal process. Some of you may have heard of this term from other therapeutic approaches as well, such as psychodynamic. If we talk about interpersonal process in our familiar terms, let's say CBT. I know this is a conference, but CBT is kind of like the history within ACBS as well, I mean the ACT as well. So if you're familiar with CBT, in the cognitive model, we always talk about the core belief system. It is about your most fundamental beliefs about yourself, about others, about the world. They use the word schemas. So from my perspective, how ourselves and others and the world interact with each other is naturally included in our core belief system. So that being said, the process dimension, the interpersonal process, is included, although implicitly, in the CBT's core belief theory. And what about ACT's term? From ACT's perspective, the context in which the psychological and the behavioral pattern was formed naturally include interpersonal information as well. Remember the psychopathology theory from ACT, right? We talk about experiential avoidance and cognitive fusion. We also talk about the functional contextualism, which means that for a lot of the psychological behavior pattern that was formed initially in that context, it was functional. But as the context changes, the pattern does not necessarily change accordingly. That's why we have problems, because we have the same pattern in a different context. But the same pattern was formed in the original context, and that was meant to be helpful for us. So from my perspective, when the psychological and behavioral pattern was initially formed, that naturally include interpersonal information, meaning how do we interact with others. So when the actual context changes, individuals will still respond to the rules, right? We talk about the rules, the rigid rules from the ACT perspective. The rules will still respond to the rules formed in the original context and thus have experiential avoidance and cognitive fusion. For example, if we grew up in a very abusive environment, we learned to be aggressive. That's how we protect ourselves. That's the interpersonal information. Other people are trying to harm us, so we need to be aggressive to protect us. But when we grew up, we may be in a peaceful interpersonal environment. However, our inner psychological and behavior pattern still respond to the abusive environment that doesn't exist anymore. But we are still aggressive to people around us. That's going to cause problems. And that's what I meant here. We still respond to the rules formed in the original context, which definitely include how we interact with others. That is the interpersonal process. That is the relational approach. That is the process dimension that we are talking about here. The second part, why does this matter to us? Why do we need to talk about this in ACT? So in clients' therapeutic relationship with us, they often enact or recreate the same dysfunctional interactions that initially led them to seek therapy. Or in ACT's term, using therapeutic relationships as a tool to collect information about clients' dysfunctional interpersonal patterns and provide corrective interpersonal experiences or new context, right? That's the ACT. It's always about context. Is a powerful way of change. And at this point, I'd like to briefly talk about the history of where this whole thing come from. Namely, how manualized treatments, mostly CBT, part with interpersonal process. Have you heard about the following feedback about CBT? It is cold and superficial. Cold meaning they only care about the procedures. They only care about the manuals. Superficial, same thing. They only care about specific manuals for specific symptoms and disorders. You must have heard about this, right? Because in ACT's world, we criticize that too. So what did the studies say? I mean, I'm not going to go into details, but as you will see here, a lot of negative feedback, not only anecdotally, but also from empirical research. But however, CBT in its early days, they emphasized the importance of therapeutic relationships. They also talk about the transference and countertransference. Can you believe that? The father of cognitive therapy, Dr. Aaron Beck, talked about transference and countertransference. I think those two terms are probably what CBT practitioners hate the most. And these are just a screenshot of the very first cognitive therapy manual. They talk about transference and countertransference in the manual. But what about CBT Association's guidelines? As you can see, various CBT professional associations in US and Canada, they basically emphasize the importance of case formulation and therapeutic relationships as well. So, and there's a gap here. People widely complain that CBT lacks warmth and depth, but history, research, and practice guidelines suggest otherwise. So what happened here? So here are some of the reality, specifically in North America, specifically in US too. So first of all, we have the managed care system. You have to demonstrate whatever you're doing is effective for the money the government is paying or the insurance company is paying. Then we have the medical model of psychotherapy. What does that mean? It means they follow a procedure of assessment/diagnosis first, then treatment for the symptoms. That's the medical model. They diagnose and treat the symptoms with manuals. Then it follows by the empirically supported treatments, which specifically means using randomized controlled trial to verify the effectiveness of psychotherapeutic approaches, which naturally lead to manualized CBT. Again, because I don't have time to go into details for this history and reality stuff, but these are just some of the background that we need to know. It has a huge influence on how practitioners do psychotherapy in North America, particularly in the States. Although I use the CBT as the example here, but the influence, the impact does not limit to only CBT. As many of you know already, there's a huge limitations of manualized CBT. It's rigid. It let people stop coming. And what's worse, they maintain or exacerbate of clients' dysfunctional core beliefs. Imagine, right? A client has a dysfunctional core belief of other people don't care about us. And they go to therapist. And the therapist only care about how to use the CBT manuals instead of them. Guess what happened? It just confirmed their core belief. See, even the therapist don't care about me. They only care about the manual. Then we will say, yeah, when we ACT or we don't talk about this kind of manualized approach. We hate that too because we care about the process, right? The psychological flexibility, the process-based therapy is a big name, like big stuff now. But what about that? So the PBT was developed to address the limitations of manualized treatments for sure, and is a natural extension of ACT. As you will see in Hayes and Hoffman's books about PBT, they make it very explicit. So PBT targets core processes that are based on testable theories and is linked to evidence-based procedures. That's the definition. I got that from the book. However, interpersonal process still doesn't have a place in PBT. If you look at read the books, they don't talk about that much like what we are talking about today, about how to using therapeutic relationships to facilitate the core processes. And there's no procedures to target this process. It's missing in PBT literature as well. So, how do we address the limitation? The interpersonal process provides corrective interpersonal and emotional experiences. Then I'm going to talk more about how to actually make it happen. So we have a few steps. First, we need to develop an awareness of interpersonal process information. So here we have to talk about a principle called participant and observer principle. It means allows oneself to feel the patient's interpersonal pull and to observe the interaction one participates in with the patient. It's a little bit complicated, but what does it mean? It means that pay attention to our own feelings and action tendencies when we are interacting with the clients. That's the very first step of integrating interpersonal process. We need to be aware of how do we feel when we are when we are interacting with the patients, and what are some of the action tendencies. What do we want to do when we hear something from the client? If a feeling or action tendency repeatedly occurs, it needs special attention. Please note here, I said it needs special attention. It doesn't mean it is problematic. It's just we need to pay attention to it. I like cases, examples, right? So let's use examples to talk about what does that mean here. So first of all, I have to acknowledge that all case examples in this presentation are constructed, meaning it's fake. It's not real clients' information. Let's see this one. Whenever you mention homework, right, in CBT and ACT, we love homework. Whenever we mention homework, the client smirked like, and said they'll do it, but they never really completed anything. And you start to feel annoyed when you are about to mention homework again, as you don't want to see that smirking anymore. And you feel that the client is not committed to therapy. What do you think? So, second step, after we pay attention to our feelings and action tendencies, we need to start to formulate a hypothesis about what possibly goes wrong. Remember, I said it again, what possibly goes wrong. Let's see if I have a repetitive feelings or action tendencies toward the client. It may indicate a potentially dysfunctional core belief system and cognitive behavior pattern. Doesn't necessarily mean the client's dysfunctional pattern. It can be ours too. So never assume it's always the client's problems. We can have our own problems that get in the way of therapeutic process as well. Then how do we find out which is which? Seek supervision, consultation, and our own reflection are good ways to find out what is what, which is which. At this process, we have to be open-minded and we have to be collaborative with the clients to explore what happened. Those are very crucial. Let's talk about case example as well. Let's say this therapist is working with a depressive client and they had a few sessions already, and the therapist is checking in with the client in this session. Let's see what happens. T refers to therapist, saying, oh, how was your week? C means client. Great, everything's fine. Therapist said, oh, was there any updates since our last session? Client hesitates and says, yeah, things went better than I thought. Oh, how so? I don't know, it just felt better. Okay, that sounds good. Okay. The client interrupted the therapist. Actually, there was a thing over the past week. Oh, tell me about it. The lady I mentioned last week. We were sort of going out on a date for a few times, then we stopped talking. Oh no, that's sad. Yeah, I was hoping that it would work out. And then the therapist and the client continue to process this, life event for a bit. Then the therapist said, oh, you know what? I noticed a pattern between us. And let's discuss it a bit. Is that okay? No, ask for permission. Client said, sure. Therapist said, I noticed that each time I checked in with you at the beginning of a session, you initially said everything's fine, no updates since the last session whatsoever. But when I'm about to continue, you usually interrupt me and share more things since the last session. And guy's like, Therapist said, I'm glad that you eventually shared things with me. However, I wonder what is going on in that process, because it seems to be a consistent pattern. And said, oh, okay, yeah. And therapist said, how are you feeling when I'm pointing this out? And I said, honestly, a bit embarrassed and a bit fearful too. And therapist said, oh, can you tell me more about that? And said, I feel embarrassed because you find out about it. It's like a secret that I have been hiding for years. It's now in public. And therapist said, oh, that feels very uncomfortable and vulnerable too. And I said, yeah, quite vulnerable. feels like you will criticize me. Hmm? And therapist said, yes, you're worried that I will use it to attack you. Client said, exactly. And therapist say, it is understandable. Feel like you're doing a wrong thing. Client said, yes. And the wrong thing is being exposed now. Therapist said, exactly. But it is okay to be exposed. It is a good thing that we can talk about that. And client said, that's true. And therapist checking again. How are you feeling now? Client said, better. It was quite intense just now, but I'm feeling better. And therapist said, that's great. And therapist said, are you ready to talk more about the pattern now? Client said, yeah, I feel like every time you ask me about how my week went, I have pressure that I have to report positive things. That's a very common one. And the therapist still continues like, oh, how is it? No? There's curiosity, open-mindedness, and collaborative. And the client said, I don't know what that is, but I just feel like I have to share good things with you. Oh, therapist asked, if you don't share good things with me, what would happen? The client thinks for a bit, saying, I'm a bad person. And the therapist like curious, how so? Client said, well, feels like if I share negative things, I'm a weak person. I see. Do you have the same feeling in other situations? No, the context here. Yeah, I feel like I rarely share negative things with other people. Oh, where's this tendency come from? Client's paused, think for a bit. Family, maybe? See, this is the original context in which the psychological and interpersonal patterns was formed. And therapist again, how so? And said, we never talk about negative things at home. Never. It was always good things or silence. Oh, what do you mean? Client said, my parents never talk about any negative stuff at home. Now I remember. We either talk about good things or we don't talk. And the therapist said, oh, I see. Do you remember how you felt then? Client said, I don't remember my feelings back then, but I think that it is now right now. Then therapist said, how so? And the client said, life has both bright and dark sides. Yeah, therapist acknowledged that. Exactly. How does that family vibe impact you? Client said, I don't allow myself to feel bad about anything. See, that's the context in which the clients learned about this pattern, but they're still using it in our relationships. And the therapist said, great. How are you feeling about saying that now? Client said, weird. It is weird to say it out loud. And the therapist said, yeah, for sure. Any other feelings? Client said, sad. I feel sad that I don't allow myself to be negative. Does this sound familiar with a lot of you, like many of you? Right? It's a very common responses to people's own emotions. Or we can say this is an experiential avoidance from actor's term as well. And the therapist say, how are you feeling when you are saying that you are sad? You know, this kind of acceptance, right? And she said, still weird, but kind of relieved. when you approach something that you experientially avoid, you know, weird but relieved. Relieved? Yeah, it's like a big thing has dropped. And the therapist, so you feel more relaxed now? Client said, yeah, I guess you can see that. It's like a burden is gone. Not completely gone, but a lot of that is gone. That's great. I'm glad you reflected on this tendency to this level. Can you see any connection between this tendency and your depressive symptoms? Clancy, what do you mean? I meant, are there any links between the mentality that you don't allow yourself to be negative and your depressive symptoms? You see where I'm getting at? Oh, I see, I think so. The more I don't allow myself to feel negative, I feel more negative. You know, this is like a soul act, right? And therapist say, yeah, it's excellent that you're able to articulate this. I said, thanks. I've read about it before as well. Therapist said, great. You know, what have you noticed in this hypothetical conversation? Here's what I think. I closely monitored the therapy process. If there was a pattern, it immediately came to my attention. So it feels like I'm kind of using like a camera to look at my own session. If there is anything unusual, let's say it's a pattern, immediately kind of beep to my mind. And I didn't point that out when it happened in the beginning, because I don't know if it's a pattern, right? It can't be just a random thing. So don't assume. Then I took an open-minded and collaborative stance to explore with the client. I didn't assume anything. I just keep asking, what is it? How do you feel? What does that mean, right? Always ask. And I focused on the client's feelings frequently. This is something that, from my perspective, from the cognitive behavioral tradition, is the thing that we don't do enough. We need to focus on clients' feelings more. And I connected this pattern with his symptoms, which is an important information in case conceptualization, right? So in ACT's perspective, it's the pattern that this person learned when he was little in the family. But when the context changes, he still responds to the original context, which makes him rigid and which makes him avoid that kind of situation and the negative feelings. So that's what I did in this process. What do you think? The third step, it is about providing corrective experiences. In the third step, there are two types of feedback that we can provide to clients as a corrective experiences. So the first one is client's impact on their interaction with the therapists and others. And second, we can use that to explore clients' internal experiences with therapist feelings. Again, I'll use case examples to illustrate this. So first of all, clients' impact on their interaction with the therapists and others. So the therapist said, so I'd like to share a feeling with you. It might not be the case, but let's make sense together. You know, this collaborative stance. Sure. So it seems that when interacting with you, I have to be extra cautious Because if I don't, you might be super angry, like outrageous. Does it connect with your experience here? And the class, no, like big no. And the therapist said, okay, how are you feeling when I'm sharing this with you? I'm offended. Sorry for making you feel that way. Can you tell me more about that? And client said, sounds like it's my fault. So it feels like I'm attacking you because you're responsible for making me cautious. Exactly. And therapist said, well, have you heard similar feedback before? Yes, a few times. And the therapist said, can you tell me about that? Client said, okay. One time, a close friend told me that he didn't want to share different perspectives with me because I usually react strongly. Oh, how did that feedback make you feel? Offended. See, similar things here. So how did that conversation go? He shut up. So how did you feel after? I felt okay. So you're still hanging out with that friend? No. So how did that happen? I don't know. We naturally drifted apart. Is it the same with other friends of yours? What do you mean? Did you drift apart from other friends the same way as that friend? Maybe. Have you thought about possible reasons? Distance? So that makes sense for sure. Any other possible reasons? Can't think about any. You came to see me due to social isolation. But you said you are a social person. So you're confused why it happened this way. Yes. Have you disagreed with anybody before? Of course. Can you tell me more about that? Okay, let me think. There's a friend who's very arrogant and likes to show off things, but he doesn't really understand what he's talking about, so expressed a different opinion that day and exploded. Oh, how did you feel? Angry. It just provided a different opinion, and it was not necessary to overreact. I agree. Providing different perspectives is normal in interpersonal communications. Exactly. Are you still hanging out with that person? No, we stopped talking a long time ago. That's understandable. No one likes that type of interaction in which people can't handle different perspectives. Exactly. Did you notice the discrepancy here? What? You stopped hanging out with that arrogant friend because he couldn't handle different opinions, which is understandable. Also, you reported that many friends have drifted apart from you, and you respond strongly if you hear a different opinion. So it seems that you and that friend share some similarities here. Ah, I see what you mean here. How are you feeling right now? Honestly, still feel offended, but I know this is a very important stuff. Great. I appreciate that you keep being open-minded, even if felt offended. Yeah, let me think about that for a bit. Take your time. So, again, what have you noticed in this hypothetical conversation? Since we don't have enough time, I will just go ahead and talk about what I did. First of all, again, I took an open-minded, empathic, and collaborative stance to explore with the client, even if the client's initial reaction was very intense. I didn't become defensive. Of course, I didn't argue with him. Because if I did argue with him, it just confirmed, maintained his dysfunctional pattern. Second, I guided the client to reflect on their past similar experiences and identify a pattern. Then I connected this pattern with the presenting issues, like why they come to see me. It's the same reason that this person is showing in the therapy. And I focused on the client's feelings frequently. I always ask, how do you feel about when we are talking about this? How do you feel when you're saying this out loud? That sort of stuff. Another case example, we can explore clients' internal experiences with our feelings. So therapist said, I'd like to share a feeling with you. It might not be the case. Let's make sense together. See, this is always how I would like to start. It's always open-minded, collaborative stance. Don't assume that we are the authority, we are always right. That's not the case. Sure. It seems that when you talk with me, you tend to stutter. Do you notice that? Yes. Can you tell me what was behind that stuttering? I'm nervous. Oh, would you like to tell me what are you nervous about? I'm nervous about talking with you. How so? You're an authority and have challenges in talking with people in authority. Well, thanks for sharing your inner experiences with me. What is the challenging part of talking with people in authority? I feel like I will be judged because they know more and also have more power. Yes. That makes sense. It is vulnerable to expose yourself in front of them. Yes. It's like I have to be very careful in what I say. Otherwise, I will make a mistake and then I will leave a bad impression and they will judge me. No wonder you're so nervous then. Right. Again, in this short example, what have you noticed in that hypothetical conversation? I used my observation of the client's behavioral cues to explore, meaning stutter. I didn't assume anything, just explore with an open-minded, empathic, and collaborative attitude. That's what it matters here. Again, I focused on the person's feelings frequently. That's always going to be the priority. Talk about their feelings. Then now, we'll have the big topic of non-collaboration in therapy. Non-collaboration was used to be called resistance. Personally, I don't like this term because resistance implies that it's something negative or they have to accept everything in therapy. So I don't like that, but this is kind of the legacy term in psychotherapy literature. So I still listed that here. So in some books or articles, you may still see it as resistance. So from interpersonal process perspectives, there's no resistance, but an opportunity to discover potential dysfunctional pattern or the context in which the client was the maladaptive pattern was formed. So it's an opportunity instead of a danger. That's how interpersonal process see it. And I'll demonstrate how. So again, with a case example. So this client didn't complete homework, canceled the immediate next session, and rescheduled for 2 weeks later. This is the context. Okay. Now, so the client showed up in the session. So the therapist asked, "Are you ready to talk about what happened regarding the homework and rescheduling?" Sure. What is it? So what do you think about the homework? Well, those are good practices, and I really should have done it before coming to the next session. And therapist said, "I'm glad to know that you also see the value of those homework. So what about the rescheduling?" Well, like I said, I think if I don't complete the homework, there's no point coming in for therapy sessions, as it is a waste of money and time. I need to be committed. I do appreciate your attitude toward our therapy sessions. How are you feeling when you are talking about it? Bit intense. Can you tell me more about it? I mean, I know the importance of homework practice, and I do think it is vital for therapy to be helpful for me, but I just can't complete it. Oh, so you feel very frustrated then? Yes, I wish I could have done it, but I can't. How are you feeling when you are sharing that with me right now? Quite anxious. Oh, so what is it that makes you feel anxious? I worry that you will judge me. I didn't do what I should do. That's normal. Many clients have this exact same feeling when they don't do homework. Yeah, that doesn't solve anything. I still didn't complete the homework. So what does that mean to you? It means that it is another thing I didn't get done. Oh, so did you have a lot of unfinished things? Yeah, that is why I am still doing a minimum wage job at my 40s. Can you tell me more about that? I like music and have many music projects to do, but I never finish any. That sounds tough. It is. Can you give me more specific examples of how you didn't finish any projects, even if you have many? Sure. Last week I was doing 3 projects at the same time, but one project is getting more difficult as time goes by. And I shifted to another, and the second one gets tougher, and I shifted to the third one. It's a very classic pattern, right? Yeah, so you ended up not finishing any. Yes. Is that the norm? I would say so. It does sound very frustrating and limiting that you can't finish anything, even if you have lots of possibilities. Exactly. Have you thought about any possible solutions? Not really. I guess that's why I'm here, right? And he laughs. Yeah, that is true. Okay, I wonder if it is possible for you to stick with one project, complete it, and then move to the next one. Yes, definitely possible. Do you anticipate any challenges? Absolutely. When it gets difficult, I naturally want to escape. Just like you didn't want to come to the session because it was hard for you to complete the homework. Laughs again. Yeah, that's pretty much it. How are you feeling now? I'm all right. Okay, so let's take homework for example. Why don't we set a small goal? Say you do the calming techniques, let's say the homework, once per week. Even if you didn't do it, you can still come to the session. The point here is not only completing the homework, but also learn to not give up easily. That is an interesting idea. How do you feel about that? Actually, I think I can do it. That's great then. Remember, homework is meant to be an experiment instead of a test. There is no pass or fail. It is a process of finding out what works and what doesn't. How does that sound? Sounds reasonable. Again, what have you noticed in that hypothetical conversation? So, again, I focused on the client's feelings frequently, like what I always do in all the examples. So client's feeling about not completing homework reveals more information about his negative belief about himself and others. This belief is easily maintained by a vicious cycle that he gives up after having challenges, and he ends up finishing nothing and see himself as not capable. It manifests again in our therapy. He has challenges in completing homework, so he chose to quit therapy, just like he quit other stuffs. So I didn't perpetuate his dysfunctional pattern. Instead, I guided him to talk about it, to disconfirm his negative belief. Basically, the negative belief is others will judge him if he doesn't do what he needs to do. So if I judge him, he just confirmed this idea again. And I also set a behavioral goal to start from small. That's the behavior activation thing. So I basically combine interpersonal process and behavior activation here. So at this point of the presentation, as we have a limited time here, so I'd like to summarize what I talked about today. So first of all, clients' dysfunctional core beliefs about self, others, and the world, or the context in which dysfunctional core processes will manifest in therapy session. Skills training approach is helpful, but usually are not enough. Interpersonal process is a good complementary method to address the limitations of skills training approach, whatever the skills is about, be that CBT, ACT, DBT, NPCT, whatever T. If it's a skills training approach, we can always complement that with interpersonal process. Interpersonal process aims to correct clients' dysfunctional core beliefs or provide a new context in which the clients can form a functional psychological and behavioral pattern using therapeutic relationships. It can also easily combine with various PBT or ACT skills training. Again, it's not contradictory. They should be combined. Non-collaboration or resistance in therapy is an opportunity to reveal clients' potential dysfunctional pattern, and the therapist can utilize that to transform therapy. So the 3 steps of integrating relational approach with ACT are: first, developing awareness of interpersonal process information, formulating a hypothesis about potential dysfunctional pattern, providing corrective experiences. Here are some of the basic principles. First, pay attention to therapist's own feelings and interaction patterns in therapy. Always keep a non-defensive, open-minded, and collaborative stance. Focus on clients' feelings frequently when exploring. Here are some of my recommended readings if you are interested. So as you can see, it doesn't limit it to ACT or PBT. They actually talk about that everywhere. And again, I have a lot of references for this presentation, again, just for your information. Thank you again. It is my honor to talk about a relational approach to ACT at this conference. And if you have any questions, now let's talk more about that.
Eugene, I think you are muted.
Sorry. Thank you very much. I open to the floor first. Would there be any questions from the floor for Owen? Owen, I'm not sure your background and training, but one thing I always find when dealing with this process base is that it harps back a lot into it. Not harps back. It's actually it has a lot of similarities with psychodynamic. I'm not saying it's psychodynamic, but I do think that whatever we started from the beginning, this is an evolution. This is what we see, and it's still highly relevant.
Oh, exactly. This is this is form dynamic. So I'm not gonna kind of take it as a original, right? It is has its tradition in psychodynamic. So that's why, because when we are having either CBT or ACT or whatever behavior therapy traditions, the pioneers wanted to part away from psychodynamic. So they focused on this here and now skills-based training. But it doesn't mean the psychodynamic ideas is not relevant. It's still very powerful. Like what I said in the history section, if we overly focus on skills training, no matter what name we call that, right? Process-based therapy or CBT or manuals, whatever. If we only focus on skills training, it misses a big part. Because usually, I mean, it works well in randomized controlled trial, but in actual practice, I mean, private practice. In actual practice, we only focus on that. Our business will fail very quickly because no one's going to come after a few sessions. Yeah.
Very true, very true. This is what I see in my daily practice too. For research wise, very highly protocol based. Yes, that's something we do for numbers, but in clinical, clients won't come back if you ever just follow protocol.
Exactly.
In fact, they appreciate it more when you provide them to them. I have a better explanation. I know what's going on now, and I really do find it very useful. For context wise, I work in a psychodynamic center actually, and I often am able to communicate with my peers, but they know wherever I can't do psychodynamic. It's just that because we use the same process-based analysis and we look at this, you can still communicate. It would still be within the same wavelength.
Exactly, right? Because psychodynamic or psychoanalysis, they have a lot more than interpersonal process, right? So that's why even like within psychodynamic tradition, we even use the term modern or time limited, intensive, focused psychodynamic. But we're not doing that. We're doing like CBT or ACT. So, but we want to borrow some of the core ideas from that tradition that still fits within CBT or ACT, and that can help us. Right? So we are not doing like a full scale psychodynamic because they have much more stuff like there. Right? But we can borrow some ideas that can be helpful for us.
True. Okay, as a closing question, what would be your advice to anyone who wants to learn process-based or even RFT or anything relating of those fields? Because as we all know, all of us who have gone through, when we first pick this up, we get very confused. We have no idea where to go, but along the way, we figure how it works. But would you have any advice for new practitioners, either ACT practitioners or any of the CBS practitioners? How could you ease their learning experience when they start picking up process-based or RFT or anything of those kind?
Well, so I think, first of all, I understand that, because this is the thing I see in my when reflecting on my own journey and other people as well. Because ACT or process-based treatment in ACT tradition, they talk about very great ideas, but sometimes the great ideas doesn't necessarily easily transform into actual practice that easily. So people will, like, after they read a lot of books of, oh, this sounds great, but I don't know what to do. That kind of idea, right? So now when I look back, this is how I would say. ACT or process-based treatment, if we treat that as a framework or it's like a basis or foundation, like a high-level way of thinking for integrating therapy from different approaches, that works pretty well for me personally. Yeah, because ACT or process-based treatment, they really talk about the underlying stuff. Instead of necessarily that much more of like applications things, right? I mean, I know they have techniques from everywhere, but what stands out to me is really their underlying integrative power. So I always use that framework from ACT or PPT to help me integrate approaches from everywhere. So that being said, when I'm doing ACT, I don't necessarily only do the ACT techniques from those ACT textbook. I draw techniques from everywhere, but my underlying idea, that's where I'm going. I'm going to facilitate the overcome the experiential avoidance to reduce the cognitive fusion, stuff like that, right? So that's what I would say. Use that as a guiding principles for integrating different approaches, different techniques. It's the core idea, the framework that really matters here.
All right. Thank you very much. You're actually the closing for the whole conference itself. This is our very last one.
Oh, okay.
And yeah. So as such, I'd like to thank everyone. I know that there are a few more others who's listening around. But yeah, thank you for joining us in this actual conference for the last 24 hours. And I hope to see everyone again sooner or later. And yeah, stay safe, everyone. And yeah, I suppose
Thank
this
you
is
for
good.
organizing this wonderful conference, and thanks for everyone participating.
Yes, thank you. All
Take
right,
care.
so I'll end the room now. Stop recording.